Hey everybody. Sorry we're a couple minutes late. Welcome to
Yeah,
Trying to Keep Up with Allison and Nilo.
we got to
I think
stop apologizing for that. We're
that's
always a couple
true.
minutes late.
Maybe we should just say like it starts
12-ish,
at 12-ish. Yeah,
9-ish, whatever.
I like that. Our guest is having difficulties joining, so I'm hoping she joins in a few minutes when she can. Um, but there's a lot to cover this week. How you doing, Nilo? I feel like it's
Uh,
been a crazy
r-
week.
Crazy week, rough morning. Someone hit my parked car, and I had to get towed to the body shop, or the tow truck had to come to like give a powerful enough jump to get it to the body shop. So, but other than that, things are going pretty well. Getting a lot done. There's actually surprising amount like going on at the FDA this week. I think maybe it backed up because of the Fourth of July holiday, but I feel like
Mm,
there's a lot of news and a lot of we're busy getting things to the FDA. I think you are too. So trying to get ahead of the French holidays. You know, Europe's going to go on vacation for August, so got to get all these things into the
yeah.
FDA before they all leave.
Well, and have you been doing some World Cup watching as well?
Um, and most of my life has been occupied by the World Cup. I don't know if you probably didn't hear it on the sibling episode because you guys were so choppy, but I went to the 2006 World Cup. My younger brother went to the 2010 World Cup. I went to the 2014 World Cup. And so like we've like gone to a lot of these things and now we're both at this one too. So it's
Did
been
you
fun.
go? That's very
Yeah.
cool. Well, our guest has decided to join us. Sorry, Dulciana, you are right on time.
All right, perfect.
Yeah, you are actually perfectly on time. Dulciana Chan, my friend,
Hi.
my dear EMC specialist that I miss so dearly. Um, Welcome to Trying to Keep Up.
Yeah.
Thanks. I'm definitely trying today.
Um, let's have you do your intro and jump into your joke, and then we shall share our jokes.
All right. I'm Dulciana Chan, a VP of Regulatory Solutions at Avanya. I know these guys from, I guess, FDA days, consulting days. So, yeah, it's been, well, I miss you guys. Nice to chat with you
Yeah,
again.
it's been a while.
I know. My joke. Why do ducks have tail feathers?
I don't know.
To cover their butt quacks.
That's a pretty good one. I like that
Good.
one. Yeah.
That is good.
Uh, and that's one we can share with the kids.
Yeah,
Yeah.
yes. I definitely got that from a kid.
Yeah. um, Allison, you want to go next?
Um, Mine's not really a joke. It's more of a I had tried to come up with a carpentry pun that would work, and I think I nailed it, but no one saw it. No? Yes?
Yeah, it's pretty good.
All
Sorry, you had to
right.
follow up butt quacks, and I don't know
I
what's
know
up.
it's hard. It's hard to follow up butt quacks. I mean, that's the winner for today. So, all right,
um,
Nilo.
the beginning of the story is legitimately true. In the frustration over my car having to get towed, I wasn't paying attention and clicked like a phishing link. So we're dealing with like potentially being like hacked. But a message to the person who stole my Microsoft Office license. I will find you. You have my word.
Oh,
Yeah.
That's a good one.
Yeah.
you have my word.
You have my word.
Sometimes I
Okay.
wish that people would just take my Microsoft. Just it's yours. Just
It
take it.
would be great.
Yeah. All right, let's dive in. We have some I mean, we've already dove into the deep end. There's some new de novos and PMAs. Who wants to take the first one? I didn't put these into the Google Doc, so somebody's got to take it.
I put the new submissions in here so I can start with this, and if anyone has anything more to add to it. So the new de novo was the Tessa spatial surgery system with the Intelio tablet. think it's from Smith and Nephew. I forgot to write it down. Um, but it's basically augmented reality surgical navigation for ACL repair. And I just think anytime I see augmented reality for surgery, it's such like I know people are doing it today, but to me it's very sci-fi. Like this is something they do only in the movies in like the year 3500 or in Wakanda or something like that. And like it's just cool that this is like a real thing. It's we didn't get flying skateboards or cars, but we did get this, so that's kind of fun.
I agree. I love augmented reality stuff, even though it kind of freaks me out. One of my favorite games, this is a shameless plug, we are not being sponsored by the Birdcage. It's
Yet,
like a
yet, Allison,
yet,
yet.
yet. I actually talked to a podcast guy who's like, I can hook you. You guys need to start
Nice.
doing sponsorships. Um, it's called the Birdcage, and it like is it kind of reminds me of those puzzle cube type things, but you have to free this bird from a bird cage. But you can set it up like the bird cage is augmented reality, so you can the bird cage is in your living room and you have to like walk around the bird cage to figure out all the clues. It's very cool.
That is cool.
Super nerdy, but I
Is it
tried to
with
play.
like, is it with like the
No,
Oculus? Oh, it's a
it's just through your phone, but like
cool.
I think I need to get one of those headsets. Like I walked around inside of a cell one time at like I think I was in Texas at University of Texas San Antonio and they had me like walk around for like this medical training program that they had and I was like this is the coolest thing. Like there's the Golgi. I can touch the Golgi apparatus.
That's pretty
I
cool.
feel like there needs to be more of this stuff. Maybe it's I think people just are nervous about walking around and falling off a cliff or something if you have the whole headset on. But augmented reality, you're supposed to be able to see things around you, right?
I think so. Yeah. I've got friends that meet up for like Friday night. They'll play for, like golf on the thing, and they can like high five their virtual people
No
and things
way.
like that. And I'm like, okay, that sounds pretty cool. I might might get into doing that because then you can just go. You don't have to go like kill your entire Saturday to go play outside. You can do it after the kids go to bed. So
Magical. And then it doesn't even have to be daytime, right? You just like go to play
yeah,
golf at like 10 p.m.
yeah. Or like I think they do some other video game type stuff, or try to unlock bird cages in people's houses. I don't know, but
Yeah.
it does sound fun.
Do you think one day we're going to be doing like you'll just be like, ugh, I need to dress this wound and you'll put on your goggles and you'll just like, like anybody could do it. Maybe. That's
Probably,
terrifying.
yeah.
I
Anyway,
mean, I guess
Yeah.
I think people are working on it. I guess I'm not going to name companies because I can't remember who
no, you
they
just say like it's because it's confidential. That's what you say, Dulciana.
Oh, okay, yeah, it's confidential.
I can't talk about it.
But yeah, I think that's everybody's goal is to be like, well, I think a layman can help you do this with the robot, basically, so that anybody could step in lieu of a physician. I mean, I think we're decades out, but there's some progress on that. Like,
Yeah.
have
I
you
don't
seen?
think
It's like,
we're not decades out from
uh,
people trying, right? Yeah. Um, yeah.
because you can like point to something in a surgical field, and you can like ask the computer saying like, "What is that?" So it's like and they're supposed to tell you, so you'd be like, "Oh, don't cut that, cut this." You know what I mean? If you need like step by step help during your surgery.
I like that. Anything to like just reduce the risk that I'm gonna have something go wrong in a surgery. I'm all for it. Why not? Um, PMAs? Should we go
You
to
do the
PMA?
Yeah, the next one there was one PMA in the last week. It was for the Bellotero Intense with lidocaine.
Did we already
It's
do the
lip.
Bellotero? I thought we did
I
one.
thought so.
Or is this their
I
second one?
I think it might be their second one, or maybe I just missed. I missed that. It got posted just this week. The decision date was before, but it got posted. So, but I think it's just a lip filler, hyaluronic acid. It's a newer version of it and has some cooler, longer term use. But I think something that people should be aware of, that the FDA views lip fillers as more risk than like robot surgical devices, more sedation devices, knee implants, like
Now,
so.
come on. As a seasoned regulatory person, Nilo, you know that might not be. You're right that it's a class three, but it probably is like because it's historically that way, right? Like,
Right, but it's not life supporting or life sustaining, so there's got to be a historic risk basis for these being higher risk. I mean, the real answer is no one's done the work to down classify it, but as it stands right now, it's the pathway to get to market for a lip filler is harder than a knee implant, and I think
yeah,
that
fair
is
enough.
more crazy on the. I think people underestimate how like or overestimate how inconsequential lip fillers are. They actually do have like they're not just like simple things. They collapse, they cause infection. They're not as simple as people get them a lot, and I just it's like, oh yeah, pay attention to this. This isn't like this as simple as it seems.
Well, it also makes you wonder, like all those like commercials that I'm getting that just probably are not FDA. Like this has not been approved by FDA, but you're just like, whoa, okay. If we know that these things are a class three PMA,
Yeah,
just try
you
this
probably you
peptide
probably get
stack in my face.
you probably
Um,
get more in Southern California than I do in
yeah,
Pittsburgh. Yeah,
yeah. All you need
yeah.
to do is just get like I had dental surgery and I just looked like I had huge lips afterwards. I was like, oh, that's all I need to do. Um, but I mean, that's my issue with a lot of these de novos. And Dulciana, you and I know, you and I have worked together on some of these that you're just like, this shouldn't be a PMA or this. And I think actually you're one of the people who originally told me of a story. I'm going to put you on the spot of
Okay.
there was a company that submitted a PMA and FDA was like, no, 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 this is a de novo. Like I've heard it going the other way around where people try and submit a de novo and FDA is like, no, this is definitely class three. Like there is no way that you can down automatically reclassify this. Um, which I had never heard of that because I thought like a de novo is an option, but you reserve your right to submitting a PMA if you want to.
Yeah, I do remember that one. And it was, yeah, it's probably maybe the only one I've ever heard of, but I feel like it was whether or not you were treating a specific indication or you were more of a tool.
Hmm.
And so FDA
Yeah.
was really happy to make it a tool, um, and I mean, basically down classify it. Which, yeah, I think is, yeah, rare, not unheard of. Because I guess they'll sometimes when you go in a pre-sub and you're saying, yeah, we think we're PMA, they're like, well, maybe we could fit you in this, this way. So there's some wiggle room, but it's not really common, I would say.
Yeah.
Yeah,
Another reason why I'm just like, don't do a 513G. Like I feel
never.
and Nilo and I we kind of went on a bit of a rant. I think it was last week about like
I'll
or
do it
maybe 2 weeks
again.
ago. Let's do it again. About how like FDA could be so helpful, like there's sometimes some meetings that I'm like, we got so much out of this meeting. It was so helpful. Like FDA was really open, talking very candidly. Not like they were saying things that they wouldn't say if I don't know if there were upper managers in the room, but it was like, oh, we can do a lot with this information. And I feel like if it's, hey, don't do this pathway. Why don't you do this and this and this? And not that they're your consultant, but there's stuff that they could do that just I don't know if they can think creatively. It's so helpful.
I feel
'Cause-
like that's
yeah.
advice that most people or most consultants actually agree on. They're just like, don't do the
Yeah,
515G.
Yeah, and don't do the pathway exactly. That's
I think it's most consultants that used to work at FDA, because the amount of clients that we pick up that have already done a 513G because a previous consultant told them to
yes.
is astounding. Like, who are you people, and why? Please tell your previous consultant to talk to any of us on this call. We will tell you why that's a bad idea.
And go with
Oh,
a
that's
pre-sub, like a well-designed pre-sub with smart, like direct questions, and you can get a lot more out of a pre-sub than you can a
Or
513G.
or an informational meeting, as Allison has converted me to.
Hmm. I'm a believer. I'm a
Yeah.
believer.
Speaking briefly on things FDA can do better, we have this thing in our list every week, and I think we'll have a larger talk later when we don't have as much on the agenda. But like HDEs, I look every week, and there have been 9 new HDEs since 2022. The process clearly is not working because if no one's using it, there's something wrong with it. And I think, if you talk to certain groups at FDA, like in cardiovascular or I know neuro as well, will actively like push you away from it because they're like, we want this device to actually be used in the clinic, and hospitals won't run HDE studies, so won't continue HDE products. You won't get market adoption, so they'll steer you away from it. So I think we got to figure out that Allison, when you get invited to the next 6 panels, like make one of those, like how do we fix the HDE? Yeah.
That's a good one because yeah, I feel like that's my second one. I was like, well, it doesn't really work so great if people want to, want to go that route. It's just yeah, your chances are so low
Yeah.
of
And
getting through.
Dulciana and I have been on some calls with like the HDE group, and it's like trying to find any way to they're trying to find any way to say no. That's what it felt like. I'm sure they felt opposite. Like we're trying to find a way to yes, and I'm like,
I, re- I remember when in the HUD office for the Orphan Products Group, I remember talking with Katie Chowdhury when she worked in there, and I felt like she was trying to say yes, but like the system around her was forcing her to say no. A lot of times, I remember having like conversations outside of the actual FDA call with her, and her going, "This kind of sucks." Uh, yeah, so I think there are some process rules and things like that they're being kind of forced into, which sucks. I hate when those happen.
yeah. Jessica says in the comments, isn't it driven by market though? Like no money. It's similar in pediatrics, large cost burden than orphan products. And I think so you don't have to show that it's effective, right? You have to show that it's safe and that there's no other product out there there's no alternative. And it has to be less than 8,000 people a year that have the disease. But I think what Dulciana and I have run into in the past is like, how do you control it so that people cannot use it beyond that small indicated population? And you have to either design the device to make sure, like, I think there was one that was like a software product, and every single time that a doctor wanted to use it, they had to contact the company, request a code so they could use it for that specific patient, but the company had to review the case before they would release the product to the person to use it. I don't know, I felt like, wow, this is so much work because it is true, it's not you can sell it, right? Like it's one of the things, it's not it's similar to a PMA except it's free and you don't have to show effectiveness endpoints. So, yeah, and a lot of folks will say like let's do the HDE first and then we'll go and collect data and then submit a PMA. So, anyway, woof. I
I think
also
the
I can I just say that I thank you, Rob, for the comment. There needs to be a late night lawyer. I think we need to make this commercial that says, "Have you been tricked into submitting a 513G?"
that's pretty, yeah, that's pretty good.
That's a good one.
Uh, the
Contact Allison and Nilo. We'll tell you
just
you're dumb.
back to
Yeah,
back, like a
yeah.
billboard. Yeah, yeah, yeah. Um, I wanted the other thing with Jessica's comment. The other thing for when you actually get or running, like get the HD approved, even, and I think part of the reason the FDA talks you out of it is the burden on the hospitals and the company. It's like continuing your clinical study, or even like more so like reporting and checking in and data monitoring and all this stuff. So it's like you're not even, and to that point of there's such a small market there already, plus you're paying so much per patient to get this in. The goal should be HD to PMA no matter what happens. And I think people are just going, the FDA's made it easier to go straight to PMA.
Yeah, I
Anyway,
think there needs to be a mechanism too for them. I feel like I've heard of some companies, but it's like drug companies that, yeah, they get a lot of money just to make a drug for a specific disease that has a very small patient population. So they have kind of this funding source, outside funding source, so that they can continue. So I don't think Devices has that. And then the other thing I wanted to say is like, so the 8,002 is an increase in number, like,
It used to be
right?
4,000, right?
Yeah, yeah. So I don't know how they, when that change happened and whether or not like increasing that would impact like how many they get. Like maybe it is just too narrow. I don't know.
Anyway, um, I have no data behind it, why, but just kind of like, hey, it seems like it's a good idea. It's there for these, I think all of us like to work on PEDS projects, and orphan products are always like, help the underserved kind of thing. And it seems like the most obvious pathway is not working the way it's supposed to if no one's using it. But I don't have a good solution yet. So when we come up with a good solution, we'll.
We're gonna just crush it, and we'll start another company.
FDA just needs to let us know, just let us have us in for a brainstorming session. We'll fix all their problems.
I think we could be like Andy Samberg and like be like, hear me out, hear me out.
Yeah.
We'll go pitch all of our ideas now. It's gonna be
Yeah. Half baked ideas with Allison and Nyla.
I think we got a lot of cool commercials that we could do here.
Yeah.
This is a brainstorming. Thank you, Dulciana. You're getting good at think of that.
All time, ever present guest, Dulciana, producing, chiming in.
No, she'll be like the salt and pepper. She'll be the DJ.
Spinderella.
Spinderella kind of up. Okay, so let's go into what else? Breakthroughs. That's you too. Go for it.
I grabbed one, and I think Dulciana, you have the other one here. I just saw this one that AI Doc, which is a first read AI for chest X-ray reporting, and it basically like looks at the chest X-ray and automatically like does a report generation, which is cool and awesome, and it saves a ton of time from like X-ray radiologist report thing. I have no idea why this constitutes a breakthrough. Like in terms of like bar of evidence, very cool. Seems like it'll be very useful. I don't understand why it's breakthrough though. Couldn't figure that out. So someone with more information.
I'm sure that was what I would always say. I'm like, get breakthrough for whatever indication, and then you can just say your device is breakthrough, and they don't, like people. That's up to you to hold that information if you want.
Yeah, and this is just the press release from them, so who knows what the conversations with the FDA was, but.
Yeah,
who works at ADOC? Don't we know somebody?
AI Doc, maybe. Probably one of our friends, like it runs this whole thing.
Okay, I know who it is. I'm gonna reach out and be like, you gotta come on our silly weekly podcast thing.
They had a different one. It's their second one, so like that's, good for them. Not gonna.
Yeah, their website says like there's 11 approved algorithms. So.
What's Sky Therapeutics?
Yeah, this one just popped up, which sounded neat. It's an ADHD treatment where it's kind of a game-based mental exercise, or has game-based mental exercises, sort of like arcade games, puzzles, kind of almost like mysteries, like unlocking things. And it's to strengthen. Yeah, it did remind me of that. To strengthen executive functioning. And I think, and I think it's from University of Florida, so it's like, I guess, a small startup. But then it seems like these gaming kind of devices, digital health devices, seem to be coming out more frequently now. So
I'm always curious if they're actually helping the ADHD or just placating it. Be like, hey, person who has trouble focusing, focus on this shiny light and don't do anything else.
Sometimes I wonder that too. But I guess, time will tell.
Yeah, so that got breakthrough. I just wonder because there's Keeley and like a bunch of the ADHD devices that use them as a predicate. So my ADHD is going to have me pull on that thread and go down that rabbit hole today.
Go down.
Yeah. Let's get Cal back on here and be like, hey, what's going on here? How are all these things? How are all these things getting breakthrough?
You get breakthrough. You get breakthrough. I put my initial because sorry, this is a note to mostly us on the call. I don't want to talk about all the things on here. So like Dulciana, I saw you're going to take the third party review one, so thank you. I have some like just fun tea things. So there was like an FDA Voices blog. We'll put the link in the chat. It's an enduring mission in a new era, FDA public health pillars by Kyle Diamantas. And I encourage everyone to click on the link and just stare deeply into his eyes.
But you'll see nothing behind them.
But I'm glad you did.
You knew I was going to.
I watched the Conor McGregor fight, but there was like some pre-fights to the fight and there were
I
people
sneezed and I missed it.
You missed
So,
it, seriously.
yeah.
But there were some fights that there was one that like this guy got punched so hard and his eyes just kind of like, like I don't know why I brought that up right after talking about Kyle DeMantis. That's so weird.
I think it's like it's not the lumberjacking or the rowing or like the random thing. It is the fact that you're like an avid fan of UFC. It's like a very random like in the
woman.
Yeah, in the onion that is Allison Komiyama. That's a layer I did not expect.
I'm a bloomin' onion at least.
Yeah, yeah.
Deep fried. I don't like. I think there's a lot of political stuff that's happened with UFC that I do not support, but I love them. Yeah, I love MMA.
Yeah.
Diving deeper into that will be another call.
Yep, that's for another podcast. So go check out the new blog. There's also
before we jump off of him real quick, he did put out in the news that he was basically like, hey, everything that Macri put into blogs, that is not policy. So like first step is like acting thing was to basically go, all that stuff that was like just written in his personal blogs, that's not real policy. So we're going to backtrack on that a little bit and go, we're going to try to do things hopefully the more structured way and not just whim of the commissioner writing a blog and saying this is what we're doing now.
Which I mostly support.
I mostly support.
Right?
I think I'm on.
I'm like, whiplash.
Yeah.
I'm like, well, but did people really think the blog was policy?
Yes.
Yes.
Macri thought the blog was policy.
Well, sorry. Okay, the people.
Yeah.
Who are the people?
I think there was some confusion on like even at the review level of like, do we have to follow this rule now? Coming from talking to reviewers and stuff like that, especially more like
confused.
Yeah, they're like, oh, is this something we're doing now, kind of thing. And luckily, it was fast enough that we all know FDA. It's like turning around a cruise ship. It takes a long time to actually change anything. But like, some people were trying to go like, oh, I guess that's how we're operating. I guess I should incorporate that into policy because it's been said by the top. So
I don't know. You're citing the blog. And be like, oh, this is my this is how I support my my recommendation is a blog.
Well, Bakul Patel, when he was in charge of digital health, was championing a ton of new policies and trying to get out in front of things and trying to make all these changes. But like, he was on the podium all the time saying these things that were like the hopes and dreams of like what could come next. But the fact was they weren't quite there yet, but review teams and industry especially would hear that and go like, oh, that's our target. So they'd go for that. And so I think, you talk to anyone that came out of digital health, like that period was confusing because there was a hope and dream kind of goal aspiration aspect to it. And then where we are today. And there was such a big gap between them that it was like difficult. And I think that was in a less, aspirational way. That was kind of the Macri area too. That was like, hey, here's where I want to take it. And I think a lot of people disagreed with it, but there was confusion of like, is that where we're going? Is this what we're doing now? Or are we? Yeah. So I do think.
Yeah. And Paul has a good point in the chat. Our president also rules with social media, so why shouldn't FDA employees also think the same about the commissioner's blog? And I mean, there have been times too when I've quoted things that, even Michelle Tarver has said, I'm like, this is clearly something. I mean, and she speaks from like, hey, we want to get more devices in home, and home is a healthcare hub. And then she puts the package together and says, now we have this READY, ready thing that we're going to be working towards. So I always like it when they back it up with, here's a program, here's something that we're going to be doing to support this. Otherwise, a lot of it is just talk. It feel or maybe not. Like, I guess it's hard to know. Um, Speaking of ready, that was a good. Do you like that transition?
That was good.
I do.
There's
Professional.
presentation slides and a transcript up from the June 24th webinar. So that is live. You can see how that all happened. I wish more people were talking about ready, and maybe because it's hard to say, I don't say it as much or don't talk about it as much, but I really think it's a very cool program and I hope that people are applying. I think it's a really good idea to get more devices into the home safely and effectively. Because there's a lot of companies that are like, I don't want to be over the counter, but I do want to be prescription home use or have, people be able to use their device safely from home or get it drop shipped to them. Which dovetails nicely with all the new human factors push with eStar and the guidance. Dulciana, do you want to talk about third party review? Because that's near
Sure.
and my favorite.
Yeah. Well, yeah, when I saw it, I had a little chuckle. FDA, yeah, reported the 510K metrics for a third party review.
30 party?
And
That's better.
but yeah, it's very sparse. I mean, you can look at it if you want to chuckle. I think there's like three, I guess, third party reviewer groups that have 20 or more reviews. So like that was the bar to get in their graphic or in their
Mhm.
count was if you had 20 or more. But it did give some nice, I feel like sometimes the process for third party review is a little cloudy, so that they have some like nice graphics and tell you like who's reviewing what and at what time, whether it's a third party or when it gets reviewed by FDA. And I know, I mean, I think, well, at least myself and maybe Allison, probably Nailu, I don't know. We're not the biggest fans of third party review, but I mean, I feel like if you have a really simple device that's really exactly the same, maybe it's for you, but I feel like most devices don't really fall into that category.
So many do. Like that's the crazy thing is that there's so many product codes that are like third party review and people see that and they're like, "Oh, this is amazing because I'll get my 510K cleared in 30 days. This sounds fantastic and I don't have to pay FDA. There's no user fee because I'm just going to pay the third party." But I'm just like, "No, there's so many things that you don't know about the program." Um yeah, I think my issue why I'm kind of why I've had challenges in the past is that there are I think maybe it's because FDA will often get this recommendation from the third party organization and be like, I'm gonna be the one who decides, right? So and because they don't maybe get a lot of third party review recommendation or like files, they'll just be like, I'm gonna go through this, or maybe now they just put it through ELSA and you will get more deficiencies, which is kind of defeats the purpose of the program. The program is in itself a brilliant idea, and I think if it worked, it would solve so many problems at FDA because it could help with resource issues. There's like so many good things about third party review. I just think there's like the game of telephone makes it too hard. And I love Prithal Baum. Like I can't remember which one I think it's, anyway, I'm not even going to guess, but she's fantastic. But I mean, it's also hard for them, right? Because they need to be experts in all these different types of devices. They're like reviewing the submission packet and then making their recommendation to FDA. And it's just, yeah, I just think, man, I think Melissa Hull tried to fix the program when she was there. Wasn't she
I'm
working on third party review stuff?
not sure. Well, we'll have to ask her next time she's on.
But there's 10.
But I
There's
think,
10 of these, 10 companies that are third-party review organizations, and I did not know that. I was like, I thought there were 6 last time I looked. But only 3 of
yeah,
them are doing, you know, 10 of them.
I think it's like one of those things that if they were like a little bit like the safety and performance pathway type stuff where, and they do limit like what is eligible for third party review, but I think it's still too broad. It's honestly like, can we back this down and like only use it for these types of products per OHT? And so reviewers actually, and then encourage companies to do it. Like if they submit a product in that code, go, hey, for $3,500, you could go to have this third party reviewed by these groups rather than the FDA and just, you know, kick it out. you know,
yeah.
stop making, kind of do that kind of thing and say, or give people the option. And that way there's like more use of it. Cause I think that I agree with you. I re-reviewed every third party review because I think I probably had 6 in the 6 years I was there.
Right.
And they were all bad too. Every single one, like I take that back. One was excellent. Like went through everything, did the checklist. I was like, perfect, done. And the rest of them were like, you you missed stuff right up front about why this is not substantially equivalent. and I was like, okay, well, I got to go through this again.
Yeah.
Well,
Woof.
6 is pretty good. I only had one. And yeah, like I think if there was a dedicated FDA person, which might not be the most intellectually stimulating position for FDA, but like, yeah, because I was like, oh, I get handed this, and again, I'm like, what is this? If you're not familiar with the process, and like, there kind of needs to be a little trust between you and the third party company to say, like, oh, yeah, they did look through everything and they did see everything.
eStar might make it a lot better. Like it might make it easier. Like because there's so much like a high bar of like at least required information to just be there to get the green in there, and you can obviously game it, but that's really obvious when you start reviewing an eStar. So maybe it's like that gets you closer. I don't know.
Yeah, I like
Could
that
be.
idea. Let's by the way, I if you are not coming to these live and you're just listening this on the podcast links later, you miss out on such fun chat. Like we can't share all the cool, fun, entertaining things that are going on in the chat, but I see you, Rob. Thank you. I appreciate all those things and things he's saying. Okay, let's talk about small business designation. There, if you make under $100 million in the last tax year, you can get a waiver to reduce the fees for your user fees. So your pre-market user fees. And they just released the dates. It's pretty much the same every year, but the small business request application window closes for fiscal year 2026 on August 1st at 4 p.m. Eastern, and the new application window for 2027, which starts October 1st, that's when the fiscal year starts, opens on August 1st at 4:01 p.m. Eastern. So if you want to start submitting your small business designation request entry into that, then start submitting in August. Fun fact: if it's your first PMA, you can get a waiver. Your first PMA does not cost anything. Uh, and if you are, it's the small business definition is different for PMAs. So it's under $30 million for PMAs, then you get a small business waiver, and it's under 100 million. So 30 million versus 100 million for all the other types of pre-market submissions. But if you have a pediatric device, it's always free. So keep that in mind. I had a company that paid their user fee for a de novo for for a pediatric device, and I was like, "Oh no, don't do it."
Oh,
Didn't get that money
do you know
back.
do you know if it's
No.
pediatric only? I just had this question, and it's pediatric only, right? It's
Yeah,
if you have adults and peds, so you pay the fee, right?
yeah,
Okay, that's what I thought.
yep.
I feel like it's not well advertised, honestly.
That's intentional.
Really? Well, I actually there was an AD that I talked to a couple years back, and I was like, "Well," and they were like, "Well, we don't know if you can get your feedback, but like, why don't you withdraw the file?" And I was like, "This is a pediatric device," and they were like, "What?" And I was like, "Oh, it's free," and they're like, "Really?" that's a free user fee. And I was like, you're an AD, like you've been there for 20 years. Anyway, I didn't rub it in, but I was like, that's good. It shows you how rare,
Yeah.
people talk about this. All right. Fun facts about small business designation. Let's go on to reports on non-device software functions. They I didn't know this, but they publish these reports every 2 years and look at non-device software functions. So they request some input on these non-device software functions and impacts to patient safety, and then they send out a report. And that is as part of the 21st Century Cures Act. And I think they're calling for comments on it. And then they, yeah, by August 13th, you can submit your comments at www.regulations.gov.
So
That's all I have to
did
say.
so I clicked on the link because I was on CDRH New, and I was curious because the ones that they have linked here are like for 2024. Is there a 2026 linked somewhere that I'm just like missing? And maybe we can find out later, come back to it, but I didn't,
No,
I
well, they
only
don't
said,
have the report yet. They're
so
calling for people to. Is that what you're asking?
yeah, well, yeah, I guess what are they getting comments on?
Like, if people have been hurt by non-device software functions, I guess.
Oh, okay. So they're collecting
I don't know.
data
I
via
didn't.
comment.
I clearly did not look at the old reports. You
I've looked
know.
at them before. They kind of the 2024 report I think came like basically linked with a lot of like the CDS guidances and things like that, and they'll update to the wellness policy. So I felt
Mhm.
like they were like kind of hand in hand. So we'll have to look on what they're actually calling for comment on here because I think it's gonna based on the previous one, it's gonna be impactful for all these people that are trying to hover around wellness at home
Yeah.
use, encouraging healthy lifestyle, preventative care, all that kind of stuff that gets into the weird, is this a medical device? So,
Yeah. No, that's a good point.
yeah.
Encouraging a healthy lifestyle. Yeah.
Yeah.
Do you think they'll ever come out with like the wellness label? Like, this is not a, like, so it's not fine print, like, kind of
Mm.
like the,
Like
because I
supplements?
feel like it's getting harder and harder to tell. Like, is this a medical device? Is this a wellness device? Like,
Right.
just random. You're right.
Yeah.
It'd be
Yes.
helpful. It's a good idea.
Yeah.
We'll
Um.
put it in the half-baked program for
Yeah, yeah,
FDA.
that's good.
Yeah.
Yeah,
Yeah.
that's good.
Yeah.
Hear me out.
Yeah.
We have this
Wellness
idea.
label.
This is a great idea. Yeah.
That one actually makes sense though, so I might have to go at the
It does.
top.
Yeah. That
Yeah,
one's good.
they get worse as you get down, get to the bottom. You
Really
go
bad.
back,
I
smoke a
like
little bit
Rob's
more, come
idea of
back.
having a third-party review gremlin. I think we pitched that too.
Yeah.
Like, we just are like, you should have
Oh,
like one person that reviews all these
yes,
things.
yes, yes, yes.
Yeah. Speaking of, I'm going to scroll down a little bit, but there was an FDA recruitment network, which I didn't know was a LinkedIn group, but it's part of FDA, and they just welcomed 53 new employees. So I was really excited
It's
to see
awesome.
53 smiling faces, and they did all their employee training. I did count because I love to see lots of women represented in that group, and more than half were women. So, whoop! Good job, FDA. And yeah, so maybe one of those people in that 53 could be a new a third-party review gremlin. So, throw it again. Hear me out. Um, Finally, town halls. Does anyone else want to talk about all these town halls that are coming up?
Um, there's a lot of town halls coming up, guys.
Yeah, yeah, that's what I was gonna say.
um, the there's a lot of biocomp ones coming up, and I honestly think they're going to be important. And Rob, who's been in the chat today, is going to be probably actively participating. But there's a biocomp risk assessment, biocomp and chemical characterization testing for extractions, and biocomp and tox risk assessment. And honestly, this probably goes hand in hand with the new 10993 updates. But I think especially for those of us who are working on submissions, the FDA's review policies around ChemCare and TRA, tox risk assessments, have been I would say generously inconsistent. I think Ed Margerson's been doing a really great job of trying to corral that to be more consistent out of OSO. But I love that they're putting this out publicly to say, hey, these are going to be like how we're gonna do this moving forward. I kind of wish they were longer than an hour each because I feel like all of these should be workshops um, instead of town halls. But it's been years of kind of like what do we do? And honestly, I think a lot of it has led to companies going because the big test houses are so expensive and still getting hit with deficiencies by FDA. They're going to these cheaper places outside the US and getting hit with the data integrity. And so the biocomp and ChemCare, biocomp and tox has been such a circle of circle of despair for a lot of companies. Honestly, even when they're uh, even with like limited contact like type stuff, hey, I have nylon that's wrapping like a wearable, external sense, and like all of a sudden we're doing, implantation studies for nylon. Like,
Stop it.
come on.
Are you being
Oh, dead
Stop it,
serious.
That's
please.
a
They forced it.
Stop
Uh,
it.
and the company was like, how do we not do this? And I was like, we can keep arguing, but or just do the test. And they were just like, how much it costs to do the test? And they just did it. Uh,
Woof. Yeah,
yeah.
Rob also
And
brings up the idea of per K-pop Demon Hunters, we can't fix it if we never face it. And I don't know if people know this, but K-pop Demon Hunters was actually about biological risk assessments.
oh, totally. The whole thing,
Whole
painted gold.
movie was
Yeah.
about like how can I'm hiding my anyway.
Um,
I think we should
but
do we should do like a comparison. I'm gonna do a blog about
yeah.
this.
Yeah. Uh,
Um, Lots of town
Jessica's
halls.
right though. Yeah, the CR didn't know how to meet expectations, and honestly, the FDA would change them month to month. If you talk to folks at Jordy or NAMSA or all these groups that were like had good, successful published things, and then FDA would change their mind on whether that was acceptable. The one side on the flip side for the FDA, none of these groups ever wanted to publish their methods extensively because that was their secret sauce and their libraries were important to them and gave them a competitive leg up, but it made sure that there was no standardization of how to do this. So the FDA is not all at fault. There is a commercial aspect here of why can't we have a standard? It's because people are greedy.
really
Heard it here first. We're gonna
Yep.
get that on a
People are
shirt.
greedy.
moral to the story.
Yeah.
Well, it is good that they actually came out. I was pleasantly surprised that they came out, but yeah, like a town hall, it's probably not gonna cut it. You needed like an hour town hall and an hour Q&A because I feel like
And they're not in
that's
person. These are all gonna be like it's Microsoft town halls. So sorry, I
The
cut you off,
the
Dulciana.
oh
Yeah, go
that's
ahead.
okay. No, but yeah, because like well, long are the days are past where you can say like yeah, the NANSA expert has the rationale or the Nelson expert has rationale. They're like, no, nobody's rationale is good.
Yeah. Go and plant it.
FDA's rationale only. Uh,
Sometimes they're not even sure though. I think yeah, there's no consensus really, really.
yeah, it's
Let's all go to these
was
town halls.
definitely
Let's go ask
frustrating.
them really hard questions. I usually like I I
So
will
they
wait now. I will like push my, like raise my hand or like there's some way to ask questions or like speak up. And I used to like I have a question. I'd like ding my bell or whatever, and then they would inevitably I'd be the first person. They'd be like, "Allison has a question." I'm like, "Oh, I feel like that kid that's always like, ooh, 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 pick me. I have a question." And I was like, "I'm
what
just gonna stop talking or like or like push it later because
what
I was like, I don't
evidence
want
do
to
we
be
have that
first."
you aren't that kid?
We
I
have no
know.
evidence. We have no
I
evidence
yeah.
for the
I
contrary
think we
at this point.
I think all of us in the on the call and in the chat were also those kids, Allison.
True. That is true. I feel seen. It's my these are my kindred spirits. Can I? There's one
That
thing that
might speak for the FDA. employee population
That
too,
is true.
honestly, right?
Yeah,
Maybe that should be the
probably.
advertisement. Are you that kid that always went and talked to your professor after class?
I'm gonna argue the way you graded this test
Yeah,
every time.
exactly. I see that I got a half a point off,
Yeah,
and
no, 1/10 of a point. Come on.
Yeah,
one tenth, and I think that was unfair.
I did this
Uh,
right.
I did it right, and I will fight you. I wanted to talk about something that I saw that I was like, oh no way, and it's Kalshi is now going to start doing future predictive market for FDA approvals and things. Discuss.
Wait, okay, because
I'm so excited.
if if there's no insider like trading for Kalshi because clearly these people are making money off of war and death and things like that. Like, can we start making money like internally? Like, hey guys, I know we're down to like the labeling updates for this PMA. Get your bets in at Kalshi now. Like, can we start doing that? Like,
It's a
we could
prediction
retire.
market, right? That's why
Yeah.
these are legal now. Like you got Polymarket, and I keep getting so many advertisements because of the World Cup stuff. Like, just let me play my two dots game without all the. Anyway, they are
Probably have
going
kept that
to
idea to myself, but we should talk about this more.
again. So many ideas. There's Kalshi. It's a stat news story. Kalshi comes for biopharma with prediction markets for clinical trials and FDA approvals.
Interesting.
Whoa. So anyway, we clearly we chose
We've
the wrong
jumped
field, guys.
we've
We
jumped the
like
shark. We
yeah.
the granola company. I think that every time too, Rob. That Kalshi is the granola company. What's the cereal?
Kashi,
Yes,
Kashi.
yes. Oh,
Kashi.
kashi,
Yeah, every
kashi. It tastes
single
like
time.
bark.
Yeah, yeah. It's absolute garbage.
No, that's grape
Yes.
nut.
Oh, yes.
But
Sawdust, right?
Kashi was not very good either. It was like bad Rice Krispies.
Yeah. Um. Oh,
Anyway, yeah. Let's get our predictions in. Maybe we should just have I was gonna hear me out. I was thinking of putting together a bracket for people do snack brackets and they're like, who wins, Oreos or Ritz crackers? And I'm gonna do one for like medical devices and have
I
people
thought you were gonna say
vote.
med device consultants, and we could have like an
Oh,
absolute.
that's even better, Nilo.
You
Oh
could take that top
man.
100 list and just absolutely burn it to the ground.
No, that's for what is it? That's your like people who are I don't know. What was it? It was like voices of
Yeah,
medtech or something. But we could do a consultant one. Oh,
yeah.
that would
Just
be
let the people vote.
Well,
so.
remember, there used to be an
I'd be out in the
FDA
first
kind
round.
of like Yelp for FDA. Remember that?
They
What?
For
still
a
they
hot minute?
it's still in the links. They still like. I just had a reviewer send it to me because I emailed saying how good of a job they did,
Yeah, they put it
and they
back
were
in.
like, oh, can you fill out the survey, like the link for the survey and add comments and things like that.
Yeah.
No, but that's the FDA survey, right?
Oh, yeah.
No, I'm talking about there was like a public, just regular survey
Really?
review. Yes. You don't remember this?
Like a
I don't
Reddit
know. I
survey?
don't. What was there was one for professors, like rate my professor or whatever. That.
Yes, it was
Yeah.
like that. It was like rate my FDA reviewer. And like, yeah, people were kind of sad about it.
I don't think anyone ever told me, which is probably for the best.
Yeah.
There wasn't a
Yeah,
lot
it didn't
about you, Nilo. I'm just kidding.
it wasn't around very long. I
Thank
think 'cause
God.
yeah. But
One star. Do not
Where-
recommend.
I have to remember that
I,
name.
you know what? We got to figure out the name, and we'll get Tim Margarine to go into the Wayback Machine and find it
Yeah,
because
Yeah,
no
yes.
one's better at the
Tim
Wayback
Margin's
Machine
always
than
good on the
Tim.
way back. That's so true.
Well,
Okay.
that's a oh, okay. Maybe I should put that. It's like a resume skill, right?
Yeah,
Way back
Wayback
Yeah.
machine.
Machine. Yeah.
Wayback
Put
Machine
it
professional. Uh, I I remember in the because we're all about to get fired.
in.
I remember there was one reviewer who was very tough, and somebody found her like there was like some orthopedic news forum or something, and they're like, we just got our reviewer assigned, and it's so and so, and she's the worst, and she's so hard, and all this stuff." And then people were like, "Oh, you should have gotten this one guy who's like so easy," and I was just like, "Oh, this is." Anyway, I think it made it harder for that company when like I was like,
Yeah.
you know we have the Googles and
Yeah.
we can read
Yeah.
words, right? So um anything else? What did we miss, guys? There's usually like I think we made it through our list, which I'm very proud of us.
Yeah. I felt like it
Yeah.
was kind of a slower week,
No,
FDA wise.
right? Maybe?
Uh, maybe. Oh, the one thing we talked about at the top, but it's not on the list, is the in the town halls. There's a Medufa 5 or Medufa 6 town hall actually in person and online on August 5th. They rescheduled it. It was scheduled for I want to say July 7th, and no one remembered that that was over a holiday, um, and so they pushed it to August 5th.
Like my husband has lived in the US longer than he's lived in Japan. And this year he's like, oh, I booked my trip to China. He was giving a talk. And I'm like, when? And he's like, oh, I come back July 4th. And I was like, you know that date, right? Like July 4th is kind of, he's like, oh, I totally forgot. I was like, oh, okay, that's fine.
Yeah.
Anyway, yeah, July 4th, that weekend is kind of a big deal in America. So, did
States,
you guys see
yeah.
any drone shows this year? There were some
Did.
so cool.
Yeah, we
Secret
went
now.
to. I actually took Rowan and my mom to a Pirates game, and they did it after the game, and it was awesome. It was very cool. I was like, oh, this also doesn't scare my dog. I like this.
That is cool. Yeah. They had one that was like, I don't know, just like there was because SeaWorld, which is very controversial here in San Diego, they always had these very loud fireworks shows, and people were like, my dog is just freaking out every night because it's not just July 4th; they do it throughout the summer. And now they have a drone show, and there's like orcas and whales, and I'm just like, oh, it's probably better also for all the living aquatic animals that probably don't appreciate all the booming
Thunderous
sounds.
echoes above their head. Yeah.
Yeah, right. Because that seemed like a good idea. Dulciana, you're the best. How do people find you?
They can find me at Dulciana Chan at avanyaclinical.com. Yeah, or on LinkedIn, all the
Yeah,
places.
all the places. Make yourself easy to find. Well, I miss working with you day to day, but it is a treat to get to hang out with you here, and we hope you'll decide to come back sometime because I think most people come on this and they're like, never again. Nope.
Yeah. No, this is always fun. Yeah. Thanks for having me. Yeah. Always, you guys are always entertaining and give those like little nuggets of detail that.
We give lots of nuggets, just so
Good and
like
bad.
chicken, like the ones that get extracted from the machine and then deep fried.
Yeah.
All right. Thanks, everybody. We'll see
Right.
you next
Uh,
week.
All right. Thanks. Bye.
Hold on, rewind. What did they say? Allison and Nilo just winging away. Regs and guidance, we'll try our luck. Just two folks out here trying to keep up.